a Monday afternoon, on the verge of summer, all of us, busy as we are, have to take time away to try to make our voices heard to the leadership of this country. Where are we? Où est-ce qu'on est? Dans quelle sorte de pays est-ce qu'on est pour qu'un lundi après-midi, on est ici à prendre le temps d'essayer de convaincre le leadership d'écouter et de faire entendre la voix des plus vulnérables, de ceux qui sont déjà sans voix. C'est abominable. I am here because, like many of you, I have the exquisite privilege of spending my days providing primary care to human beings, all human beings. Some of them were born here and some were not. Some came early and some came late. And in all cases, they never, ever, ever identified themselves primarily to me as a refugee. Because fundamentally, they are human beings. That is what they want to be. Of course, they have had experiences that we need to take into consideration. Of course, that is why we are here today, because they need us to band with them, to have our voices join with them, for them to have justice. But fundamentally, refugees are first and foremost human beings. They are like us, and they are like me. And I could spend a lot of time echoing some of the comments of my very eloquent colleagues and tell you about all of the health conditions and all of the many ways that the health of my patients who happen to be refugees will be affected. But instead, I'm going to tell you about another interface of my life and refugees. The very first so-called refugee I interacted with, who actually, again, never identified himself as such, was a classmate of mine in medical school. Today, that remarkable individual who overcame huge odds is a plastic surgeon who spends his days reconstructing hands. That is what happens to refugees when you give them a chance to become everything they can be.
Yes! There you go, Katherine!
I have another close acquaintance who happens to be the father of my godson, who also came here as a refugee, also never called himself a refugee. He is now, after coming to this country with a shirt on his back, like the stories we heard today, is working for the CIBC. His kids are in your kids' soccer teams. His daughter dances ballet with all of your children. They spend their days longing for the same things that you and I long for, participating in this community, being parts of this amazing country that is ours. That's what happens to refugees when you give them the chance to become everything that they have a right to become. Il y a des réfugiés dans mon environnement qui passent leur journée avec leurs enfants dans l'école de ma fille. C'est les parents des amis de ma fille. Ils font du bénévolat dans les écoles, ils apprennent aux enfants à lire, ils font partie de la communauté. They are there, they represent all the richness of what they came from. They represent the richness of this country that clearly some leadership is trying to undermine. It is our responsibility to recognize that healthcare, the right to healthcare, is far, far greater than the right to pills. It is the right of human beings to be everything they have a right to be. Because not only do they need us to fight for them, we need them. We need them to become our doctors and our teachers and our colleagues and our inspiration together as one country, as Canadians who no longer makes a distinction about who's worth it and not worth it, who deserves and doesn't deserve, who has a right and who doesn't have a right. On a tous le droit à la santé. We all have a right to health care. And all those of you who put your signature to these documents, I want you to look in your communities, identify these people who you so-call refugees, and think about what they contribute to your community. Remind yourself that we are all in this together. We are one Canada. We will not stop fighting for one Canada, one healthy, rightful, united, and rightfully healthy Canada.
Yes.